Hello, I'm Dr. Angel Holland, and I'm the Director of Clinical Education for the UAMS Doctor of Physical Therapy program. I want to share with you the unique clinical education program that we have here at UAMS. At UAMS, we strive to focus on giving our students the opportunity to apply the knowledge they are learning in the classroom. This begins in the first week of the program through the integrated clinical experiences. Each first-year student will start seeing patients in the first semester of the program. The Integrated Clinical Experiences, or ICE1 rotations, are 4-hour blocks of time each week where the student is placed in an outpatient setting, a pediatric setting, or a geriatric setting to work with clinical PTs to practice the skills they are currently learning in the classroom. At the end of this first 2 semesters of the program, each student will have completed 8 weeks of part-time clinical work in an outpatient setting, 4 weeks of part-time work in a pediatric setting, and 4 weeks of part-time work in a geriatric setting. This allows the students to experience therapy across the lifespan before ever leaving campus to start their full-time clinical rotations. Students also have the opportunity in the first year of the program to work in what is known as a standardized patient experience. This is where the PT student is put into simulation experience with actors serving as the patients. This creates a real-world experience for the students to practice their evaluation skills. Each first-year student will complete this portion of the clinical education process 4 times before going on their full-time clinical rotations. Students also participate in the interprofessional student-led clinic on campus with other healthcare students in the second and third years of the program. This is in coordination along with the second integrated clinical experience, or ICE2 rotation, which takes place in the fall and spring semesters of the second year of the program. Overall, there are 34 weeks of dedicated full-time clinical rotation experiences. The full-time clinical experiences are arranged according to the systems-based curriculum. The first full-time clinical rotation takes place in the summer of year 1 and takes place in an outpatient orthopedic setting. The second full-time clinical experience is in the spring semester of the second year and is in either an acute care, otherwise known as a hospital setting, or in a neurological rehab setting. The third rotation takes place in the fall of the final year of the program and is either in an acute or neurological rehab, depending on which setting was completed in the second full-time rotation. The final clinical rotation takes place in the final spring semester of the program and is an elective rotation. This means that the student gets to choose what setting they would like to gain further clinical experience. A variety of settings are offered for this placement, including pediatrics, sports medicine, women's health, and home health, just to name a few options. I would like to give answers to the questions I am asked most often in regards to the clinical rotations. The first question is this: do students get to choose their clinical rotation sites? My answer is sort of. Let me explain this. Students will get the opportunity to make what we call a wish list of their top 5 to 6 choices of the available options for each rotation. I then utilize a software system which automatically places students in one of their selected rotations. I approve all student rotations prior to revealing the list to the students to ensure that each student is placed in the best possible learning opportunity for that particular student. Students can make a request for a clinical rotation to a new site if we do not currently have an affiliation agreement with that site for student placements. In this case, the student making the request for the site will get first priority for that placement. The next question on my frequently asked questions is, are students guaranteed to do all of their clinical rotations in Northwest Arkansas? This answer is definitely no. Due to the limited number of clinical rotation sites in Northwest Arkansas, specifically in acute care and neurological rehab settings, there are not enough placements for all students to complete each clinical rotation in Northwest Arkansas. Students should be prepared to spend at least one of their required rotations outside of Northwest Arkansas. On the flip side, I also get asked if students have to do their clinical rotations in Northwest Arkansas. The answer here is also no. You are not required to do any full-time rotations in Northwest Arkansas. We do not require in-state or out-of-state clinical experiences. Although I do believe it is a valuable experience to go to different sites that are in different geographical areas, I think this enhances the overall clinical education experience for the student, but it is not mandatory. And the last frequently asked question that I get is, are there certain facilities where students cannot complete clinical rotations? The answer to this is yes. As a student, you are not allowed to return to a facility where you worked as a tech or have been a long-time patient. You're also not allowed to go to a clinic where you have a family member who is part of that staff. Occasionally, there are clinical sites which are not deemed appropriate for student placement. All clinical sites are evaluated by myself to ensure a positive and fulfilling learning experience for our students. Here's an overview of the part-time and full-time clinical experiences that we have discussed. These are all what we have discussed as being built into the DPT program here at UAMS. We highly value the clinical education experience and understand the importance of this part of the overall curriculum plan. If you have further questions regarding the clinical education program at UAMS, please contact us via email at ptprogram@uams.edu.